Right now at 5 o'clock, a moment of optimism for North Carolina. We could hear as soon as tomorrow that the state will take another step to reopening.
And of course, it all depends on the numbers and the case totals that we've been bringing to you every day. So let's take a look at the latest data just released this afternoon. The state completed more than 9,200 tests yesterday, and 677 of those came back positive. That's about 7.3% of the tests. And that is good news because in order to reopen, the state wants to see a 14-day drop in the percentage of positive tests. Here's a look at where we are. You see the beginning of this month, we were averaging about at 8% positive, but that has been trending down slightly over the past week.
As we look at our numbers, we see them remain stable, that we believe we can move forward to easing restrictions, and salons would be part of those easing of restrictions just at the end of this week.
Along with hair salons, here's what would also be at stake in phase 2, restaurants and bars indoors, public playgrounds, and more people will also be allowed to gather in groups. All of these things will allow people to move a bit closer together. And that obviously leads to more chances as well that the virus could spread.
Yeah, and leaders in one local town are so concerned about that. They're talking about having their own restrictions just for them. Let's go right now to Channel 9's Elsa Gillis, who's live in Davidson. And Elsa, you say in the next hour, town leaders are going to talk about those restrictions.
Yeah, Scott, what if a town isn't comfortable stepping forward into phase 2? Here in Davidson, they are looking at options to potentially keep some restrictions in place or even add some restrictions that we've not yet seen in other parts of our area. Here are the key areas the town is going to discuss tonight. They're on your screen there. First, face masks. Town leaders will discuss tonight whether to make them mandatory in Davidson. We've seen that as a rule across the country, but not here. Other options, they could also do a public awareness campaign on masks to encourage more people to wear them. The big move we'd see as a state in phase 2, of course, is indoor dining at restaurants. Davidson has a few options they're talking about tonight, keeping indoor dining closed, only allowing outdoor dining, or allowing them to open with social distancing. The other key things town leaders will talk about: personal care services, playgrounds, and day camps, all things that are set to change as we enter phase 2. Now, I'm going to talk more about those other areas they're looking at coming up at 6. From what I can see on the agenda tonight, they're just discussing options to protect the public health of residents here in Davidson. We'll see what comes from it. Back to you guys.
Elsa, thank you. We know you're going to stay on top of that, and we will, of course, let our viewers know as soon as they make any decision. Meanwhile, if you're not a grocery store or any other business that was allowed to stay open, you have been hurting. Look at this new information from the Retail Federation showing that sales at retailers were down 14% in April. Every category they track went down except for, as you might expect, shopping online. But even the grocery stores did drop back down after the pantry packing surge back in March when everybody was stocking up. The biggest drop, though, was clothing stores, which saw a nearly 90% drop compared to this time last year. Well, but it says relief payments and pent-up demand could help stores rebound once the restrictions are lifted. But again, the big question is, when will all that happen?
Nursing homes are battling deadly outbreaks across the state and here locally. We've been telling you about that. But some other residential care facilities are also reporting hundreds of cases and nearly 50 deaths in the state. Well, now there are some growing concerns from those families, too.
It just makes me, as a mama, scared of what would happen.
This mother is worried about her son after a case at a Charlotte facility for people who have severe disabilities, despite the strong safety measures in place there. Right now, that facility has only one confirmed case, but the virus has already caused outbreaks at so many other types of facilities. Channel 9's Mark Becker looked into her concerns to find out what that facility is doing about it.
About a mile down the end of this country road on the edge of Mecklenburg County is a different kind of long-term care facility. One where the residents aren't senior citizens, but children and young adults with severe disabilities. And on Friday, parents here learned that one of them has the coronavirus. An imposing fence and locked gates surround the RHA Howell Center, but they were not enough to keep COVID-19 out of this home for more than 100 profoundly disabled children and young adults.
I was notified on Friday that there was a positive case of the coronavirus at the center.
Patty Amos's son, Patrick, has been living here for 20 years. He was born with severe disabilities. His body is fragile and would be no match for the virus.
It just makes me, as a mama, scared of what would happen.
Amos can't figure out how the virus got in, especially because she says RHA had gone above and beyond, locking down the facility back in February and not allowing families in the building, even for Patrick's birthday 2 weeks ago.
Patrick turned 39 this year, and we sang happy birthday to him through a window in the door. And, no hugs or kisses or anything.
The facility's director couldn't talk with us today, but Amos says she was told they tested everyone here yesterday, staff and residents, hoping to find and stop the virus before it reaches any more of the young people they're trying so desperately to protect.
It's a monster we can't see. We just can't see it. But as a mother and a father, darling, it's just heartbreaking.
We don't know yet when the test results here will come back. Until then, Patty Amos says all the parents can do is wait and pray. In East Mecklenburg, I'm Mark Becker.
In the last hour, we got in a statement from the attorney for the Howell Center saying, quote, "I can confirm that we have had positive COVID-19 results at this facility and that every resident we serve there has been tested as of today." The statement also says we have taken aggressive actions in areas where we have had positive or potential positive test results to protect both our staff and our clients. Within the past 2 hours, the state released its latest count of cases in nursing homes and residential care facilities. Right now, it's tracking 77 outbreaks at nursing homes, including 23 in local counties. There are 28 outbreaks at residential care facilities, 10 of which are in our area. Now, combined, those two types of facilities, more than 3,000 cases counted for and more than 60% of the state's deaths.
A trend that we've been tracking for weeks now has grown. People in the Hispanic community now make up a majority of the cases in Mecklenburg County, 34.5%. Now, based on the most recent numbers, they make up just 13.6% of our population. Today, our government reporter Joe Bruno heard from the county health director, and Joe, she pointed out that trend that could be behind the disparity in numbers here.
The county hasn't said just how many, but they are saying they are starting to see a large number of construction workers get COVID-19. Now, they haven't seen any outbreaks, though, at specific construction sites that would meet NCDHHS outbreak standards. Officials tell me, though, they are not releasing where these construction workers do their work at this time, but they say they are working with the construction companies and subcontractors. The health director brought this up during the county's reopening committee meeting this morning. She also said a third of the county's cases are among the Hispanic community. She says a majority of the cases involve young people under 40, and this number is rising rapidly. The county is planning to target messaging to the Hispanic community.
This is a group that we're going to need to really bear down on with this communication plan we're talking about and getting information out to them about masking and social distancing.
The CDC recommends that construction workers wear face coverings while on the job. They also are discouraging the use of shared tools or equipment. Back to you.
Joe Bruno live tonight. Thanks, Joe.